Hello and welcome. One of the biggest challenges facing those in a war zone is getting medical attention in the chaos all around. In the case of Gaza, when Israel attacked in December, there was the added horror of being trapped. As the death and injury toll mounted, the situation for the territory's hospitals and medical centers became more and more desperate. Life was not easy even before the Israeli war at the beginning of this year, which killed more than 1,300 Palestinians and 13 Israelis. A siege imposed on the Gaza Strip in 2006 had devastated business, education and healthcare, and the continued fighting between the Islamic group Hamas and the more secular Fatah had totally paralyzed the government. But even after the war ended last January, things failed to improve for the 1.5 million people who live in the world's most densely populated spot. Reconstruction is slow as building materials are generally not available and the flow of aid and medical supplies has been sluggish. So today we ask, is politics making a bad humanitarian and healthcare situation in Gaza even worse? Remember, you can join our conversation with your questions and comments. Log on to livestation.com/AJE. You can enter the chat room to take part, and of course we'll take your phone calls on the show as well. Joining me today is Dr. Mads Gilbert, a Norwegian professor of emergency medicine who's been traveling to Gaza since the 1970s to offer his services as an act of solidarity with the Palestinian people. We caught up with Dr. Gilbert in Chicago, where he launched a US speaking tour. Well, he and his colleague Dr. Eric Fossey worked around the clock in Gaza's hospitals during the Israeli offensive of December and January and kept the rest of the world informed of what was happening as well. And joining us from Gaza itself, we have Mahmoud Daher, an official with the World Health Organization based in the Palestinian territory. And I welcome both of you to the show. Dr. Gilbert, if I can start with you and ask what it is that has stuck with you from that time in December and January. What memory has really lingered with you the longest? What's burned into your mind about what was happening there?
I think, first of all, the heroic efforts of all the medical staff in Shifa Hospital, the doctors, the nurses, the volunteers, and not to forget the ambulance paramedics. I mean, the way they performed and stayed by their patients and never gave up was more than impressive. It was really heroic. The second impression, I think, is the pictures of all the injured children. You have to remember that 1 out of 3 killed was a child, and half of the injured were children and women. So we had a massive influx of innocent civilians with horrific injuries. So these two impressions, the courage and the suffering, made an everlasting impression on me.
Of course, Dr. Gilbert, a lot of the real harsh images didn't make it on television. They did appear on the internet, and I saw some of those very, very disturbing ones. How did you, even in spite of being a doctor and seeing what you do on a regular basis, especially as you work overseas, how did you cope with what you were seeing psychologically?
Well, I think all emergency personnel, be it a firefighter or a policeman or a doctor or a paramedic, we are trained to be extremely focused on what we're doing when we are in the situation. That doesn't mean that we don't have feelings. However, we have to sort. We have to be concentrated on the task we have, on the duties we have while at work, and then we have to talk together and vent out the feelings afterwards. And I can tell you, both Eric and I, we had our long, not hours, but minutes of crying in the evening when we went to bed. So the way to deal with it is to keep focus and keep a positive focus on your work and not be overwhelmed. That's not easy.
Mahmoud Daher, it's good to have you join us from Gaza itself. And I wonder, when you look at what was happening in Gaza in December and January, how do those events compare with some of the other disaster zones that you've had to deal with as the World Health Organization? How did the attacks, Israel's attacks on Gaza, differ?
Well, what happened in Gaza is coming or came on top of a long time of siege and the closure on Gaza Strip. The whole health sector in Gaza was already overstretched. It's been since June 2006 that the whole situation in Gaza is being deteriorating. As you described in the beginning of your talk, there have been no enough supplies to come to the health sector. Before the crisis, before the offensive, there have been a lot of medical items that were out of stock in the Ministry of Health in Gaza, and there have been a lot of materials that didn't come through the borders. All these issues did affect the response, and as Dr. Gilbert said, truly that the heroic work of the health staff did the good response to the crisis. without their courage, without their intensive work, that could have been much more worse, dealing with a massive, with an influx of people coming at the same time at Shifa Hospital, for example, in the first day was extraordinary. And dealing with this situation on top of a long term of shortages and long term of lack of supplies, that is different from any part of the world. I mean, in any area, access to healthcare services and access of goods is maintained, while in Gaza it didn't happen for more than 2 years.
You know, Mr. Daher, I was wondering, you know, for most of the people watching what was going on in Gaza and the horror of what was happening for the people trapped there, it seemed the world community was powerless to help. And is the lack of supplies, is the lack of facilities there the biggest obstacle you had to face as an agency?
Not only. I mean, during the crisis itself, there have been difficulty to reach the injured in the areas that were affected. Some people were crying for help, and ambulances and paramedics couldn't reach the areas because of the intensity of the war, because of the intensity of the fire that was in the area, and the impossible access by ambulances, by paramedics. There have been people who were stuck for days crying for help, for us, for the Red Cross, for the Palestinian Red Crescent Society, and all these efforts were not helping in getting access to all those who are crying for help. There have been more than 100,000 people were displaced from very dense areas and going into the city, and the needs for these people were another burden on the organizations that are supposed to give help.
Right. Well, Dr. Gilbert, I want to read for our viewers an SMS message that you sent out on the 3rd of January from Gaza when things really got desperate here. For those who haven't heard this, of course, now people around the world are very familiar with this message. But this is what you said in your SMS text message on your phone. It says, "They bombed the central vegetable market in Gaza City 2 hours ago. 80 injured, 20 killed. All came here to Shifa. We wade in death, blood and amputees. Many children, pregnant women. I have never experienced anything this horrible. Now we hear tanks. Tell it, pass it on, shout it, anything, do something, do more." Of course, that, you know, you returned to Norway with something of a hero's welcome for your efforts and your sacrifices in working in Gaza. Although there were those who criticized you for mixing medicine and politics. Do you think that it's possible in that kind of situation to separate the politics and medicine?
No, I don't. And I don't think there is a division between medicine and politics, because medicine is all about the conditions of living for common people, and the conditions for living is a matter of distribution of wealth and safety and security for people, and those are political issues. So medicine has always been political. And I don't think that is a drawback. I think, on the contrary, we need to look at the framework and the precondition for health and for a good life. And you have to remember that in Gaza, what happened now in December and January was 100% man-made. This was not an earthquake. This was not a tsunami. This was a premeditated, planned, deliberate attack on 1.5 million people who had been starved for 2 years and were on their knees before the bombardment started. Right. And as you said rightly, 13 killed Israelis, of whom 3 were civilians, 1,500 killed Palestinians. So it's completely disproportionate, and we could not shut up. We are not reporters, we are not journalists, but as you know, Israel kept the whole Western media out of Gaza, and it is our duty to report on the condition of our patients, in this case the population in Gaza. So there is a connection between medicine and politics, and we should be aware of it.
In fact, you've been going to Gaza since the 70s, Dr. Gilbert. This latest incident, of course, had put you very much more in the limelight, and Israel actually called you a propagandist for the Palestinians. I wonder how much it's complicated your situation, how difficult it's going to be for you to get back into the Palestinian areas now.
Well, you know, the current situation in Gaza is still very difficult. They are still keeping the siege and the blockade of Gaza, and the humanitarian efforts to rebuild Gaza and to get people shelter and schooling and food are still being hindered both by Israel and by the US government's limitations on who you can cooperate with. So I think that we need to put pressure on the international community to reopen Gaza, and our situation to get in is a very small matter in that context. We should focus on the right of the people in Gaza, the civilian people in Gaza, to have access to the international help. I believe Israel, North Korea, Burma and Sudan are the only 4 countries in the world who are denying the international community to do their humanitarian efforts in a disaster situation. And even worse, this disaster was created by Israel, actually.
Well, I'm going to ask you both to stand by. We've got to take a very short break. We'll have more of our discussion on the worsening conditions in Gaza Strip in a moment. As we pause, let me remind you, you can join the conversation with your questions and comments by logging onto livestation.com. Enter the chat room in there. You'll see there's a conversation taking place. And we'll be right back.